The seatbelt sign dings on. Your calves feel tight. You glance at the map. 7 hours to go. Here's the simple fix most flyers overlook. Compression socks and a few smart moves that keep blood flowing, swelling down, and comfort up. In the next minutes, you'll learn exactly which socks to buy, how to put them on without a wrestling match, and the one mistake almost everyone makes at the top band. We'll hit 9 field-tested tips, plus a bonus on whether you should pop an aspirin. Spoiler, probably not. Stick around for tip number 6 if you've ever fought with a sock in a cramped airplane bathroom. It'll change your life mid-air. Ready? Let's keep your legs happy at 35,000 feet. Picture 2 travelers. One is healthy, aisle seat, drinks water, walks every few hours. The other had recent surgery, sits by the window, barely moves. Same plane, very different risk for swelling and clots. Start by sizing up your situation. Longer flights, about 4 hours or more, recent immobilization or injury, a prior clot, active cancer, pregnancy or postpartum, hormone therapy, obesity, smoking, or multiple risks together raise the stakes. If that sounds like you, compression socks go from nice to have to smart prevention. If you're low risk and on a short hop, moving regularly and hydrating may be enough. But once you cross into long-haul territory, plan for circulation. Choose the right socks, pick an aisle if you can, and set a timer to move. Unsure where you land? Quick rule. If your legs often swell on flights or you've been told you have risk factors, treat yourself as higher risk and be proactive. If you have complex medical issues, ask your clinician before you fly. They can tailor the plan. Here's the sweet spot for most travelers. Knee-high graduated compression around 15 to 20 millimeters of mercury at the ankle. That's usually labeled mild or class 1. It's strong enough to help venous return, yet comfortable for all-day wear. If you're higher risk or already use medical-grade garments, your clinician might suggest 20 to 30 millimeters of mercury. But don't jump up a level without guidance. More isn't always better. Too much pressure, especially in the wrong size, can cause discomfort or marks. Focus on graduated compression, tighter at the ankle, gradually less up the calf, to push blood upward. Look for clear sizing charts, moisture-wicking fabric, and a smooth, non-binding top band. Flight socks, athletic compression, and medical brands can all work if they're truly graduated and correctly fitted. If in doubt between 2 levels and you've never worn compression before, start with 15 to 20 millimeters of mercury. Comfort leads to compliance, and compliance wins at cruising altitude. Compression socks cover foot and ankle, the engine room of swelling, and that matters. Calf sleeves skip the foot, leaving fluid to pool around the ankle. For flying, go socks, and keep them knee-high. Thigh highs can bunch, slip, or feel hot. Knee-highs are the proven, practical choice for travel. Big rule: never roll the top band down. Rolling creates a tight tourniquet that can dig into your leg and defeat the point. If the sock feels too long, you likely need a shorter size, petite length, or a different brand. The right sock sits below the knee, smooth and flat. No cuffs or donuts. Bonus comfort features to look for: a wide top band, flat toe seams, and breathable knit. If shoes are snug, consider a thin travel pair rather than cushioned running compression to avoid cramped toes mid-flight. Great compression feels like a firm handshake, not a chokehold. That starts with measurements. In the morning, before swelling, measure ankle circumference at the narrowest point above the ankle bone, calf circumference at the widest point, length from the floor to about 2 finger widths below the knee crease. Match those numbers to the brand's size chart. If you're between sizes, follow the ankle first. That's where pressure is measured. Wide calves? Look for wide or full calf options. Very short or tall? Choose lengths labeled short, petite, or long. If your numbers fall outside off-the-shelf ranges or one leg is significantly different, consider made to measure. When the socks arrive, test fit before travel. The fabric should lie smooth, heel cup aligned, no wrinkles or folds. Walk around the house for 20 minutes. If you feel pinching at the top or tingling toes, resize. Put your socks on first thing in the morning on travel day, before swelling builds. If your flight leaves later, put them on an hour before you head to the airport. Keep them on from gate to gate, during the airport wait, through the flight, and for a couple of hours after landing if you tend to swell. On overnight flights, you can sleep in them, but remove them when you're in bed at the hotel unless your clinician says otherwise. If you're connecting, keep them on for the whole journey. For super long itineraries, bring a spare pair to swap into mid-trip. Fresh elastic feels better and keeps pressure consistent. And remember, compression works best with movement. Set a phone reminder every 2 to 3 hours to stand, walk, or at least do ankle pumps. Your socks will amplify those efforts. No more wrestling match in a tight lavatory. Try this sequence. Dry legs, no lotion. Slippery skin makes fabric slide and bunch. Turn the sock inside out to the heel. Slide toes in, set the heel, then unroll up the calf. Use rubber dish gloves. They grip fabric so you can guide without tugging your skin. Aim the top band. Land it 2 finger widths below the knee. Smooth out wrinkles as you go. Donning aids help. A simple frame or silky liner can be a lifesaver for limited hand strength or mobility. Take breaks. If you get winded or frustrated, pause and shake out your hands. Pro tip for tight pairs. Feet slightly pointed down, then flex up once the heel is in. And never yank from the top band. Work the fabric gradually from ankle upward to protect the knit and your patience. Compression is powerful, but it's not a force field. You still need movement and fluids. Book an aisle seat when you can. It's the simplest way to bank extra steps. Every 2 to 3 hours, stand up, stroll the aisle, or at least do this mini routine in your row. 10 ankle pumps, 10 heel raises, 10 toe taps. Keep a refillable bottle and sip steadily. Dehydration thickens blood and worsens fatigue. Avoid crossing legs for long stretches, and keep the space under the seat in front of you clear so your ankles can move freely. Alcohol? Go easy. Caffeine? Fine in moderation, but pair with water. Think of compression as your assist and movement as the main event. Together, they turn a cramped tube into a manageable marathon. Compression isn't for everyone. Skip or get medical clearance if you have severe peripheral arterial disease, very low ankle-toe pressures, advanced neuropathy with poor sensation, open skin wounds, or fragile skin on the lower legs, major foot deformities that create pressure points, or severe uncontrolled heart failure. If you notice new numbness, tingling, cold toes, pain, or a deep groove from the top band, remove the socks and reassess the size or talk to a clinician. Diabetes? Many people fly safely with mild compression, but foot checks matter. Inspect skin before and after. Varicose veins or mild leg swelling. Compression can help, but correct fit is key. When in doubt, choose the lower pressure range and monitor comfort. The goal is gentle, steady support, not strangulation. Compression fades with wear, heat, and time. To keep the squeeze honest, wash after each wear or at least every travel day. Hand wash or machine wash on gentle in cool water, inside out, then air dry. Heat kills elastic. Avoid fabric softeners and bleach. Store flat, not crumpled at the bottom of a backpack. Watch for the telltales: a top band that rides down, fabric that feels floppy, or socks that slide into your shoes. Most pairs last 3 to 6 months of regular use. Frequent travelers may need to replace sooner. Mark the purchase date on the package or in your phone so you're not guessing mid-trip. Bringing 2 pairs on long itineraries lets you rotate and reduces wear. Plus, you have a backup if one goes missing in the laundry at your hotel. A common myth says, just take an aspirin before a long flight. For most travelers, that's not the move. Aspirin can irritate the stomach, interact with other meds, and doesn't target the deeper clot risk the way movement and properly fitted compression do. If you're high risk, your clinician may recommend a different strategy, like medical-grade compression, and, in select cases, a one-time anticoagulant dose. That's a medical decision, not a YouTube one. The better universal plan: hydrate, move, and wear the right socks. Those 3 steps protect comfort and circulation without unnecessary side effects. Knee-high graduated compression socks, 15 to 20 millimeters of mercury for most. Non-latex rubber gloves for donning. Donning aid or silky liner optional. Refillable water bottle. Aisle seat selected when possible. Reminders set to move every 2 to 3 hours. Spare pair for connections/long trips. Lightweight shoes with roomy toe box. Here's the bottom line. Pick knee-high graduated socks in the right size, put them on before swelling starts, combine with movement and water, and take care of them so they keep doing their job. That's the simple recipe that keeps legs comfortable, ankles from ballooning, and long flights from feeling like punishment. If you have special risks, loop in your clinician. Otherwise, you've now got a flyer's toolbox that actually works. If this helped you feel more ready for takeoff, like this video, subscribe for more smart travel guides, and share it with the friend who always swears their feet double in size on landing.